Welcome back to Taking Charge of My Cancer, episode 36. And joining me today is Jim Wagner. Dr. Wagner is an occupational therapist, certified hand therapist with 28 years of clinical experience working in the upper extremity orthopedic setting. He received his post-professional clinical doctorate from Rocky Mountain University of Health Professions with a specialty in hand therapy. Jim is a credentialed in physical agent modalities and is certified strength and conditioning specialist. He currently is the team leader on the Guthrie Hand Center and is an adjunct professor of an accredited occupational therapy program. He's been involved in competitive powerlifting, bodybuilding for 35 years and has been in 28 competitions. Has traveled extensively teaching on topics such as kinesiology, taping, cupping, instrument assistance, soft tissue mobility, orthotic fabrication, and blood flow restriction training. He's a member of the American Society of Hand Therapists and has been published in the Practice Forum section of the Journal of Hand Therapy and served as the webinar committee coordinator for the education division of the ASHT. So thank you so much, Jim, for being here with me today. It's really a pleasure to have you here in the podcast.
Thank you so much, Durley. I'm very excited about being here. I appreciate the opportunity and look forward. Hopefully, we can have some good times and learn something. Maybe glean some good information today. So
perfect. So I met you at the National Lymphedema Conference in Philly back in October, and enjoyed really sitting in one of your classes talking about assistive ASCT. Is help me out. Is
the adjunctive, I think it was adjunctive therapies for lymphedema drainage and manual techniques.
Yes, and then we were using a lot of the instrument assistant, like similar to the Graston devices, things like that. So that was a really good, like, seeing a different perspective. I have never been in a specific course for like Graston or anything like that, but you really gave us a really nice inputs, and I've been practicing some of the stuff that I learned from you. So thank you for that.
Great. Yeah, it was a great conference, and I was there on behalf of Hawk Grips Instrument Assisted, and there's various camps that are out there, and it's I was using what they call the instrument assisted soft tissue mobilization.
That's what I was looking for. Yeah.
Yep. And then we talked about some of the cupping techniques to use and for manual lymph drainage, and some of the kinesiology taping for those patients that have lymphedema that may need to manage some of those symptoms as well, besides just using some traditional manual drainage techniques like you would use.
Exactly. So if we go back, you want to tell us about a little bit of your journey, like how do you went from doing powerlifting to get involved as an OT, and now we were just before I started this podcast, you just told me you just did your certification in manual therapy and occupational therapy and manual therapy. So tell me a little bit about your journey. How did you end up getting involved with lymphedema and these kind of like hog grips and so forth?
Right. No, I appreciate it. It's really been quite the journey, I think, and I'm very thankful. I thank God for the many blessings in my life. I'm very thankful, man. I honestly never thought it's definitely been a gift. I never thought I'd be where I'm at. And again, there's so many intelligent people, just amazing intelligent people that are out there like yourself and others that I get to meet. And I've met in the last even 5-10 years, and just to be part of this community that helps people go through various injuries or illness, cancers, lymphedema, those types of things. And so I guess to tell you a little bit about my background is I was the first person in my family to go to college. I was pretty much voted most likely to not succeed in high school. I pretty much majored in weightlifting, in cards, and not going to class. But there comes a point in a young man's life when we really have to either grow up or we just hit the bottom. And so I guess maybe I started to grow up a little bit. So from there, I did my first teenage bodybuilding competition at 15. I came in 4th place out of 4 people. So that was my claim to fame.
That's awesome.
And then really just loved the health and fitness industry. I really found that it was kind of like, if you want to say, for lack of a better term, my safe space. It was a lot of fun. A group of people that I met were energizing. They're involved in a lot of the fitness, strength training, powerlifting, bodybuilding. So I did a few competitions at that point in my younger years, and then found that bodybuilding was too much. It wasn't that much fun because you really had to diet a whole lot. So I got more into lifting heavy things fast. So I just started doing some powerlifting, and began to do pretty well in those areas there too as well. And I really enjoyed it. In that time there, I looked for a profession where I thought I really love to work with people who have been through difficult times. I looked into both allied health professions, occupational therapy, physical therapy. Make a long story short, was accepted into the Cuca College occupational therapy program. And have really loved it. Its holistic view, which I think encompasses all of our allied health professions. It really takes a look at the whole person, the individual, from the things they do in daily life that can be affected by injury or illness, and how do we get that person back to the highest level of independence through a wide variety of modalities, such as from the psychosocial aspect of things to the biomechanical approach. So after that time, once I graduated, I worked in a brain injury hospital for a couple of years, which was an amazing experience. It just goes to show how the body can be both, I think, resilient, and also how easily it can be injured. There's a dichotomy I find in things, and I kind of a middle of the road guy with that. I've seen some people, they bang their head and it changes their life forever, and some people have crushed their whole body and end up walking out of the hospital with a straight cane. So the body is quite amazing, and I think I know it's an amazing design, and to have the ability to try to help some person along their journey that way too as well has been a very rewarding experience for me. I would say probably after my college years, I continued in the powerlifting and that type of aspect, and really tried to integrate that into my clinical practice, because the effects of exercise, as you know, as a physical therapist, are just, I mean, it doesn't are immense in our cancer patients, and those are the patients that are going kind of just to be active, increasing blood flow. There's been some recent studies that just come out. Also take a look again at the effect improvements in cognition with our patients, overall well-being. Of course, there's some things you always have to watch out for if you have an injury or illness that you have to maybe be careful of. But being active is a huge part of that. And I think that was a niche for me where I could really kind of bring that into my practice. Do I get out and put somebody on a bench press or do a deadlift with somebody? No, absolutely not every patient, but I do try to incorporate strength and conditioning and exercise as much as possible in my daily clinical practice. So at that point, and again later on, I just became to really be enthralled with the profession, and began to teach instrument-assisted soft tissue mobility with hawk grips. And then was trained by through them, was one of the only Katsu masters in the country. His name was Dr. Jim Gunderson, and that we taught blood flow restriction training that helped improve overall skeletal muscle mass and strength at a much lower rate than traditional weight training would be.
Do you want
that?
Jim, do you want to extend a little bit on that?
Yeah, blood flow restriction training is a technique using some kind of a pneumatic band or a cuff strategically placed in a couple areas of the body that restricts venous outflow and limits arterial inflow. It doesn't completely occlude the blood flow unless you have a particular product that truly occludes that. But what they found is that by doing that, you create they call a lack of homeostasis within the banded limb. So what happens is you create a significant acidic environment where you actually shut down certain muscle fibers, and the body calls for greater recruitment of these type 2 muscle fibers that are usually only hit under heavier loads. So now you can use this and to help to achieve greater strength and muscle growth faster than you would get under normal conditions that those who might be undergoing illness or injury can't usually get because they have to get to that 75 or 80% of their 1 rep max. Now you can get to that earlier with a much lower load without risk of injury to the soft tissue structures in the nervous system. So it was really a great experience. And I was taught by Dr. Jim Gunderson, who has since passed on, who was one of the only Katsu masters in the country, who was trained from Japan. So that's really made a difference in my practice too as well, and helped to mitigate some of that age-related and even injury related muscle atrophy and wasting.
Have you have come across patients who either have going into active cancer treatments, or they're cancer survivors that has been utilizing it?
I can say I have not with active people going into active cancer, and that's probably a precaution or contraindication with those particular patients right there. And based on, again, their circulatory system, what type of treatments they're getting right now, cancer drugs, those types of things, radiation, all that stuff. But I have used it with post cancer survivors who have had who are we don't use it on the lymphedema, like a lymphedema on an extremity with that there because of the compression. But I have had it with some of those people who've had cancer in the past, and we're trying to mitigate some of that that sarcopenia or that muscle atrophy due to whatever. And so there's been some nice results with that.
Nice.
There's a lot of literature spilled over. It's actually a very safe treatment when applied correctly. And so many of the patients that I use it with now are musculoskeletal patients, but I have had some that have had mastectomies in the past that have utilized it on their upper extremities and lower extremities to help with that how should I say it the whole exercise process and in building back up muscle mass and strength over time. So
do you do any specific volume with it? Do you do
yeah. So one of the things with that is, again, once you determine what particular product you're going to be using, there's lots of them out there in the market. It could be B Strong, it could be Rock cuffs, it could be a Delphi unit that has a portable blood pressure cuff that goes along with it. Once you determine what product you're going to use, again, how to use it safely and make sure you get cleared by your physician, those types of things, to exercise and utilize this. And what you'll do is it's basically higher repetitions with a much lower load. So, and because of this, and think of this band or a cuff that's compressing the arterial and venous system on the upper extremity and up around the upper part of the thigh and leg. So what that does is, as you contract the muscles, it creates venous pooling. It doesn't allow that venous outflow to go back except for through the muscle pump. And what happens is it still allows arterial flow in, but the venous flow out is much slower, and it creates that venous pooling where you get a significant increase in acidic environment, and you get a significant increase in those chemical mediators you get after heavy exercise. And again, what it does is creates not just local changes distal to the band, but also you get a significant release in growth hormone from the anterior pituitary. You get some other cascade of hormonal growth factors from the nervous system, because your body is calling for greater recruitment from muscles, because those type 1 oxygen muscles that really need all that oxygen aren't getting that oxygen that they demand for the imposed activity you're doing at that time. So let me just say it this way. So if those that like to exercise and they get that muscle pump that you normally get, that fullness of that muscle, you get it at a much faster rate, much earlier on, and much more intense, and people love it. And so it still allows that flow and still allows the blood flow, but it really kind of slows it down, and then it engages those muscles much different. So you keep the load very low. So it's only about 25 to 30% of your 1 rep max. So very low, higher repetitions with less rest period. Okay. And so again, you can do this. Some people even do it on a daily basis. Some people use it at certain periods within their training program, whatever. So there's a lot of really good things. Some people, they've seen now doing some studies with people just walking with them on.
Okay.
You can take them out to the gym or do them just things around the house. So there's a lot of neat researches out there on it now. So.
Got you. How did you end up landing working with hack grips and using like cupping and K-tape and some of the instrument assistant devices for soft tissue mobilization?
So I've always found that so much of what we do as clinicians, no matter what condition we have, is we do a lot with the soft tissue and nervous system. So much of it is, I mean, I know we have to know bony structures, joints, arthrokinematics, all those types of things. But so much we do is soft tissue related, whether it be post-surgical or, an injury that happens or occurs or a trauma or whatever. So I was doing a lot of hands-on manual stuff, soft tissue, and it really had some nice effects. But then I began to learn more about instrument-assisted soft tissue mobilization and began to utilize it a little bit and dabbled with some different companies, different tools, and those types of things. And then I was introduced to Frank Osborne through Hawk Grips, who owned it. And a great guy, a lot of fun, and really liked his philosophy on it and how he wanted to kind of get it out there to the masses. So he said, why don't you come on and we do a little work to try a little teaching? And so we did. And I really kind of fell in love with the staff we worked with, a great bunch of people. And then their instructors are top-notch physical therapists, athletic trainers from across the country. And I was one of their only OTs that was on staff. And so we began to kind of teach level 1 and level 2. So basically it's utilizing a high-grade stainless steel instrument or tool or whatever you might have with different curves, a concave and convex edges on them that you fit to the body part, and you begin to do a little soft tissue work. I think it's got a bad rap over the last few years or so, if not maybe more so, because people do it very aggressively. It's a highly neurological technique. So, but sometimes the least amount of pressure and force you can use actually gets the job done better. So I found some really nice results with it. And so again, from there, we sprang other relationships where we began to get into cupping. So we take a look at, remember when Mark Phelps came up out of the water, you know, swimming, and he had these pocks all over him.
Yeah.
So apparently, Durley, that was because he had a chest congestion and didn't want to take any kind of drugs that might
Oh.
be misconstrued as performance enhancing. So that's what I was told. So
Oh, I didn't even realize that. I thought he was just having just for soft tissue, that they were just working on it because he's swimming.
Yep, I'm pretty sure that's what that was for. So, it's been used, you've been around a long time. A lot of these techniques, such as instrument assisted, cupping, these types of things, it's been around with Eastern medicine for quite some time. And then they've morphed over the years, and we've had more research in those types of things as well. So it's another form of fascial mobilization and mobilization of the nervous system. So if muscles are tight and restricted and highly sensitized or really irritable, this is another form of fascial mobilization, whether you use a tool or your hand with the cups to help decompress that area, increase some blood flow, calm the nervous system, and get people to move and feel better a little bit. So it's another technique. So
Perfect. If you can pick 3 valuable tips that you learned through your journey that you can advise to our audience, cancer patients, cancer survivors, and healthcare providers who work with cancer patients, what that will be?
I think that the number one thing is, is humility. Humility should follow with most anything that you do, really. And what I mean by that is that, but humility with strive to know and understand more. We'll never get to the bottom of the amazing design of our bodies. There's so much that we can never, I don't think we'll ever be able to unlock. But if you're not familiar with working with somebody, don't give up on that person. Learn more. Acknowledge that you don't know everything, because I'll tell you what, there's a lot I don't know. Acknowledge you don't know anything. You go out and you learn from other people and surround yourself by people smarter than you. And that's what I've always done. If I look to find someone who's stronger than myself, smarter than myself, which there's a lot of people out there like that, and I just go up and meet them. I try to engage them and say, how did you get there? So, and help me understand. And the same thing with my patients, and the same thing with those patients who might be going through cancer treatments right now. If you don't understand something, don't be afraid to ask. Have the humility to do that, or ask for help. And the same thing with a clinician therapist who might be not working with somebody who maybe they're worried about getting somebody into exercising. Maybe they're neutropenic and not really sure on how to incorporate exercise into their program. Have the humility to kind of go out and get some help, garner some help, and then be ready to be resilient with that, and also go into to new learning with that as well and put it into practice. So I'd say humility is number one. A strong work ethic is number two. I mean, you kind of, there's a quote by a basketball coach one time. I forget who it was. He said something like, in life, there's no in between. You're either in or you're out. I forget who that was. I'm having a brain freeze now. So my wife says I'm kind of like a light switch. I'm either on or off in a lot of things, which isn't always good. So I think that you have to be resilient, and you have to push forward, because the alternative really is to kind of, I think there's so much to learn and so much to be a part of. You have to be careful about doing too much and not have a nice rest or work-life balance as well, which sometimes I struggle with that. I don't know about you. Sounds like you do too, Durley.
Yeah. Yeah. Sometimes we preach for that all the time. Then we look at us, and it's like you want to just put so many plates there, and you want
Yeah.
to try to be efficient in every one of those. But yes, you're right. Sometimes we tend to put
Yeah.
more that than our own family in many occasions. So yeah.
Yeah, yeah, right, right. We take on too much, overworked and underpaid, I guess, if you want to say
Yes,
that.
yes, 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 absolutely.
So that, and I'd say, sometimes is at that the thing I've really kind of held on to the last few years or so is really taking time. There's an author named Matthew Kelly that I like some of his books, and he has this book, and I'll try to remember the title here in a minute. I think it's The Rhythm of Life, where he talks about spending time in the classroom of silence, and really as you take time to sit and just be still. We're in a world where, especially if you're sick or ill or anything, you have that going on, you really you seem to be a lot of things running through your mind, and you're out as you're thinking about doctor's appointments, those types of things, therapy appointments, finances, all this stuff. Take some time to sit outside or to get out into the world. Just look at the creation that's around you and the beauty that God has given and stuff like that. There's so many beautiful things that are out there, and just take time for silence. I found that is one of the hardest things for people to do. And I think it's because we're just not in tune with it anymore. We got TVs running in our face all the time, radios playing, phones up in our eyes. I can't even see the print on them anymore. I need my glasses. But I think taking time in that classroom of silence is a powerful lesson for us, and not being afraid of what you might hear. So just listening for a while and then continuing on with it. So it's a beautiful experience. So.
Great. How about the most painful lesson that you have learned in your journey
Oh gosh.
that you can be? And I know it's a hard one.
Yeah, I think I find that in my, yeah, I'm gonna have to go back to um, I think in the journey that I found, and I guess basically is knowing who you are. And there's that I think it's a Greek saying, or is it Greek, or nascite ipsum. I think it was know thyself. And so knowing who you are first before you get into something, meaning is it something you're going to go 100 miles an hour? Are you a procrastinator? I guess learning who you are before you do something, because I found a lot about myself after engaging in an activity or a particular certification or training that I want to do. And sometimes I can go a bit over the top. I'm a bit intense with that stuff. So I think taking on too much for me has been a painful lesson, because you end up doing, instead of one thing good, several things bad.
Yeah.
And when it comes to life struggles, when you look back, really the most important thing that the people are going to be there for you is your family, when it comes to that stuff. And so great, you have these great credentials and stuff like that, but they really don't mean squat when it comes to the reality of life. So I always laugh about, I'll get another certification, but it doesn't mean anything if you ask me. It just means that I've got a whole lot more to learn, and not enough time in my hands to do it. And so I need to get a little bit better time management. So,
Okay. Okay. If you want to translate that to some of the patients that you have worked with for cancer, have you have an experience that has been painful, or, when you're working with the type of population, since you've been involved in a little bit more with lymphedema and cancer patients?
Yeah, we have two occupational therapists in our hand center who work with lymphedema patients who have lymphedema. And so they do a lot of that there. I have done some work with axial cording, soft tissue work, and those types of things. Also, soft tissue related post mastectomy patients that have. And I think the number one thing that I've found that I've made mistakes with is not listening as much as I should. I find that happens broadly across the healthcare, and I've made a pact with myself to make that change. The number one complaint I hear from the vast majority of my patients, no matter if they've gone through, some cancer-related issue or a musculoskeletal issue, is that people don't take the time to listen to their complaints.
Yeah.
So what I've always learned is what they haven't always learned is that if you sit even just for a few minutes and listen more actively, people will tell you what's wrong with them most of the time and what they need most.
Yep.
And I have these goals in mind for them, but my goals don't mean squat. It doesn't matter what my goals are. It matters most importantly what their goals are. And
Absolutely.
so I've been overzealous in some of my exercise prescriptions and then have found that people don't like that, and had to dial it back, or I'm able to tolerate that. I've had these ideas in my head that things that I want to focus on, and they're just not their goal. So I think that's the most painful lesson I've had to learn I actually have been in practice 30 years now. I think I graduated in 94, if that ages me a little bit, but,
Okay.
so I think active listening is the biggest, most painful experience that I've had.
Okay, that's very good. And I hear that quite often. And unfortunately, in our healthcare system, it's happening more and more
Mm.
because the pressure, right? So
Mhm.
sometimes, you can have a wonderful physician and they can be very knowledgeable or they can be a great surgeons, but
Mhm.
it's no time to spend with their patients and
Mhm.
listening to the patients. So it's
Yeah.
discouraging because it's like, really? So sometimes I try to tell my patients, it's like, you walking into that physician office, you bring a list and you tell them you're not allowed to leave until you don't answer these questions, you like it or not.
That's a
But
great point.
you are
Mhm.
my physician and you have the right to stay here and
Mhm.
listen. And again, it's not like they're gonna spend hours, right?
Right.
That,
Mhm.
but really come across your point and get some of
Mhm.
the answers that make sense, right? So that's
Yeah.
going to be really important because sometimes it's like in and out, like when you barely open your mouth, they're already leaving the room. So it's like,
Right. Yeah. I remember in a mini fellowship I did years and years ago, and the physician's name was, I still remember it, Dr. Mark Barretts. I think he's out of Philadelphia or something, or Pittsburgh. I can't remember exactly. And I went down there, and he was a very busy man. But what I saw when he was there is that he would come in and he spent just as much time with anybody else, but his body language and the way he sat and the way he looked at the patient when he came in, sat there, and it made you feel like you were in there for 20 minutes, when really in reality, you're only about maybe 5 to 8, 5 to 10, maybe, or something like that there. And so even just the way that we as professionals hold ourselves, look people in the eye, be present in the moment, simple things can make things seem like you really actively listen. I think it's going to take a grassroots revolt, for lack of a better word, amongst healthcare professionals and those that we serve to. So we can actually show those bean counters that, listen, man, we need to take care of our patients.
yeah,
Yes, we're going to look at the bottom line, but that's the reason you're here and you have a job, is because we're taking care of those on the first line,
exactly,
so,
exactly.
but
Is anything that you have that will be a value for our audience, and will you share that with us?
anything that I have,
Yep.
oh gosh. Um, I'd say in regards to anything, or
Like anything like exercise, all your
oh
experience you have with like maybe for the lymphedema, like axillary cord web
yeah,
syndrome that you've been kind of like say that you work with. Is
yeah,
anything in particular you want to share with patients about like, what kind of outcomes you have, what works
gotcha.
for you on that?
Yeah. I think honestly, if we go back to take a look at occupations, and I of occupational therapy, and in the taking a look at the occupations as being everything, your daily living skills when it comes to that, is we need to have both of an occupation based approach and a biomechanical approach when it comes to taking care of our patient. What I mean by that is that we need to know what people do every day and how to help them modify their environment and activities to be able to get back to doing those types of things through many different ways, but also understand the cardiopulmonary systems, the musculoskeletal systems, and understand how wounds heal and those things happen after a particular injury illness, so we can manage both of these together to help people get better. And I really find that when people get through that, into those, especially those early on phases, is helping our patients get back to being active, as much as active as possible. I think if there's any great, I guess, panacea or anything like that I find that exercise is one of the most important things I think that people can do. And not everyone has to go out and pump iron in the gym. Not everyone has to go out and do CrossFit. But I see more and more now, maybe it's with social medias or those types of things, that those people in their 60s, 70s, 80s are getting out and doing load-bearing exercises back into working out and changing. And they've been through some traumatic things. I've seen people with single limb amputations, upper lower extremities, different things like that, and they're out doing amazing things in the area of health and fitness. So I say, don't be afraid. So if that's, I guess, other than looking at a particular condition or technique or something like that at all, I'd say try to find a partner, someone that can help you, especially if you're by yourself with these things and maybe you're and feeling down or kind of out, or like maybe you can't do this. Getting someone to help you into a position where you can begin to make some small gains. And I got to tell you, I've seen some people that have put in some exercise programs, even individuals that may have had a stroke, a cerebral vascular accident where they have limited motion on one particular side of their body. We set small goals for them to get back into exercising and doing some weight training, and the excitement and the recovery that they see is so much. Even if they don't have the major recovery they're looking for, they feel overall better. And when you feel better, you move better, and when you move better, you're more active. Your psyche is better. Everything else. So I think that that's one of the biggest things that I'd recommend for anybody else is get out and be active and move as much as you can. Even on the days that you may be feeling sick or ill, find a way to kind of, instead of laying on the bed all day long, find a way to get up and move or do something that might be engaging. So.
Exactly. And fortunately, we've been growing so much and things have changed so much
Mhm.
with treating just cancer patients. Back
Mhm.
then it used to be like, oh my God, you have cancer, don't do anything, you're in bed.
Yeah.
Caregivers will just bring all the food to their beds and you're
Yeah.
not allowed to move, or patients with lymphedema, you don't move that limb at all,
Right.
nothing with that arm. And fortunately now it's all the opposite. We know how exercise helps
Mhm.
so much with all these secondary cancer effects, fatigue, even just
Mhm.
the nausea, just
Mhm.
the mental health part of it, just going through this situation. And
Huge.
we know as well that, how skeletal muscle mass and the amount of body fat mass is such a huge correlation with developing
Mm.
edema and identify sarcopenia. And
Mhm.
so the more you exercise, the better you're gonna get through all this journey. And
Right.
it really is gonna decrease a lot of maybe other secondary effects that cancer can create for you. So
Right.
that's super important.
Yeah.
And
100%.
yeah, so you already mentioned one of the books, but is any other couple of books that you would recommend to the audience?
Yeah, just open full disclosure. I love to read. I mean, and I love to. I'm a I'm a nonfiction guy. I kind of like things that challenge me, both mentally, spiritually, physically, those types of things. I love to read biographies. So any book by C.S. Lewis is one of my favorite writers. He's a prolific writer. I think it was the 20th century. He's got a lot of great books: The Chronicles of Narnia, Screw Tape Letters, anything by him, Abolition of Man. Those are some great books. Um, One of my others, Thomas A. Kempis, The Imitation of Christ. It's one of the most challenging books you'll ever read. It's an amazing book. It's something I keep a desk copy with me probably everywhere I go. And then there's another one that I really found to be really, really good. It's a very small book. I have it right here next to me. Searching for and Maintaining Peace, a small treatise on peace of heart by Father Jacques Philippe. And it's really just takes a look at really is if you're dealing with anxiety or fear or trepidation in your life, and how to really kind of maintain that peace and really kind of offer that stuff up. It's very difficult. Life is trouble sometimes. It's difficult,
Yep.
especially our patients go through these injuries and illness, and I see that a lot. And even us as clinicians, we take a lot of that home with us sometimes.
Mhm.
And I think that's in my quest for knowledge, and there's a difference between knowledge and wisdom. Is that I want to gain a little wisdom along the way to how to deal with that stuff myself. So, and those things I can take that back to my patients and say, like, this might be something maybe beneficial for you, whatever. Um, I think those are good. Again, the other book is by The Rhythm of Life by Matthew Kelly, which is another great book. There's so many good ones that are out there, but those are kind of my big ones right there.
Okay, perfect. Awesome. How about any podcast?
Podcasts, yeah. There's some good ones that are out there. You know, I used to try to listen to some political podcasts, and that stopped that really quick. As the number one way to get depressed is to listen to the news. I don't care what news station
Agree.
you listen to, shut them
Totally.
all off.
Yeah. Agree.
um, so I think there's some great upper extremity podcasts, Wisconsin Hand Center podcast. We have our own podcast called Low Country. Hand podcast, and my friend Bob Phillips and I, he started it, and he let me come along with him, and we talked to some people in and outside the field of upper extremity rehab. We just talked to a guy named Jed Johnson, who was a big grip strength specialist, a big grip strength world renowned grip strength world record setter. So those are some cool. There's a lot of cool things. There's just too many to listen to. There's some really neat ones that are out there. Let's see, what else can I think of? Gosh, I can't think of them off my head. I have them listed in my phone here because I just opened them up right there. So, but there's some really cool ones out there. So those are my two favorite ones.
Okay, great, awesome. Is any other question you wish I will have asked you and will you have answered to wrap up?
Jeez, any other questions? Let's see. That's a good one. I've never been asked that before. I would say, I think you asked me this before we talked about it. I don't know. What's my favorite movie?
Okay.
I have my favorite. I'm a Braveheart guy. If you haven't noticed that by now, man, I'm like, I feel I was born in the wrong century. I should be out on the ground with a big sword and shield in my hand, screaming freedom, that type of thing. So, I like those type of movies. I think in my book reading, I like nonfiction, but in my movies, I'm also kind of like a Guardians of the Galaxy guy or something like that. Sometimes, plus the soundtracks are really cool on those two as well. So
Awesome. So Jim, how can people find you?
You can find me online. I only have one social media site, which is on Instagram. It's CHT_power71. So there's that. You can look at some different sites. Hawkgrips.com has some stuff on there. I'm excited to announce that I will be teaching with the International Academy of Orthopedic Medicine in the spring with Ann Preto-Lorke and her team. So I'm going to be starting my training and stuff like that with them this year. So I'm excited about that. So, hey, and my daughter said to me one time, "Hey, Dad, you're actually Googleable." So apparently you can Google. Everybody's Googleable. Apparently I am too. So yeah, I've made it, I guess.
And I will put your information on the show notes as well, so people can get a hold of you for us specific questions.
Be
So
great.
thank you so much for doing this with me. I really appreciate it. It was a lot of fun, and I'm sure that people really will get a lot of great information from you. I really appreciate it.
No, thank you so much, Dorothy, for having me, and I really hope everyone does well. And thanks for doing this and being a shining star in our profession. That's for sure. We need more of this. So
Thank you so much. You have a great evening.
great.